picture this for a moment. It is a Tuesday morning. You are sitting at your kitchen table with a cup of coffee in your hand. You open your banking app to see whether your Social Security payment has been deposited, and it is not there. So you grab your phone, you call the Social Security toll-free number, and you wait. 10 minutes, 30 minutes, 1 hour, 1 hour and 39 minutes. That was the actual average wait time last year, according to AARP. Then suddenly, the call drops. A recorded message plays. The connection is gone. So you decide to drive down to your local Social Security office, and when you arrive, there is a notice posted on the door that reads, "By appointment only." You try to schedule one, and you are told the soonest available appointment is over 4 weeks away. Meanwhile, your rent is due. Your medications need to be paid for, and you have no clear answer about where your money went. This is not a fictional situation. This is exactly what thousands of seniors across the United States went through in 2025. And if you do not take 3 very important steps, it could happen to you as well. My name is Edward, and I help retirees and seniors understand the real rules behind Social Security, Medicare, pensions, and retirement finances. Not rumors, not fear-based headlines, only verified information from official sources. And today, I need to talk to you about something critical. There are 3 major developments happening right now in 2026 that everyone receiving Social Security or planning to needs to understand. First, Social Security offices have lost a significant number of employees, making in-person help much harder to access. Second, the phone system went through a serious breakdown, and even though improvements have been reported, getting through to a real person is still not guaranteed. Third, the Social Security Trust Fund is projected to run short in as little as 6 years. And if lawmakers do not intervene, benefits could be reduced by 23 to 28% automatically, as required by law. But here is what most people misunderstand, and this is why you need to stay with me until the end. There is one mistake that 36% of Americans say they are planning to make because of this situation. And that mistake could cost them tens of thousands of dollars over time. I am going to explain exactly what that mistake is, and I will give you 3 clear steps to protect yourself. Everything I share comes directly from SSA.gov, the Congressional Budget Office, AARP, and the Kaiser Family Foundation. No speculation, no guessing. Let me begin with a real story. Robert is 67 years old. He lives in a small town in Missouri. He worked as an electrician for 38 years. He paid into Social Security his entire working life. He retired in 2024, and his monthly benefit was $2,015. Robert did most things correctly. He waited until full retirement age to claim his benefits. He had direct deposit set up. He managed his finances carefully. But in early 2025, his local bank was bought by a larger institution. His account number changed, and he needed to update his direct deposit with Social Security. He tried calling. He could not get through. He called for 3 days in a row. At one point, he waited almost 2 hours before the call disconnected. So Robert drove to his local Social Security office in Nevada, Missouri. But what he did not know was that more than half of the staff there had recently left due to a government buyout program. The office was overwhelmed. He was told he needed an appointment, and the next available one was 5 weeks away. Robert did not have a My Social Security online account. He had never created one. He was unfamiliar with Logan.gov, IDME, or the new one-time PIN system. Without an online account, the only way to update his direct deposit was in person. For 6 weeks, his Social Security payments were sent to a closed bank account. 2 full payments over $4,000 were returned to the Treasury. Eventually, everything was corrected. But during those 6 weeks, Robert had no income. He missed a utility bill. He had to borrow money from his daughter. Here's the key point. Robert did not do anything irresponsible. He simply did not realize that the system around him had changed. Identity verification rules were updated in April 2025. Staffing levels dropped, and he was caught in that gap. This is exactly why I am making this video, because what happened to Robert can be avoided, but only if you understand what is happening. Let us go through the facts. First, the truth about Social Security offices. On March 27, 2025, the Social Security Administration released an official statement titled, "Correcting the Record about Social Security Office Closings." In that statement, the SSA clarified that since January 1st, 2025, no local field office has been permanently closed or scheduled for permanent closure. So no, there is no nationwide shutdown of offices. However, here is the important part. The SSA reduced its workforce by around 7,000 employees, going from 57,000 down to about 50,000. That is roughly a 12% reduction. And according to AARP, nearly 80% of the 2,500 employees who accepted voluntary buyouts were from field offices. 40 offices lost more than a quarter of their staff, 11 lost more than 1/3, 3 offices lost more than half of their workers. In January 2025, the SSA also introduced a rule requiring appointments for most in-person services. Walk-ins are no longer accepted in many cases. They also announced a plan to reduce in-person visits by 50%, shifting more services online and to phone systems. So technically, offices remain open. But for many people, especially in rural areas or those less comfortable with technology, access has become much more limited. Now let us talk about the phone system. According to the SSA Performance Dashboard updated April 10, 2026, the average wait time in March 2026 was about 7 minutes, with an 83% answer rate. That is a major improvement. But earlier in 2025, the situation was very different. AARP reported that average wait times reached 1 hour and 39 minutes. Callback options took around 2 hours, and 28% of callers were disconnected. The issue became serious enough that Senator Warren requested an official audit. While things appear improved now, the key takeaway is this: the system can change quickly. What works today may not work tomorrow. You should never rely on only one method to contact Social Security. Now let us discuss the trust fund. The Social Security Trustees Report from June 18, 2025 states that the Retirement Trust Fund is projected to be depleted by 2033. At that point, only 77% of benefits could be paid. The Congressional Budget Office updated that estimate in February 2026, projecting depletion by 2032 with reductions up to 28%. The new $6,000 senior tax deduction also plays a role. According to the SSA chief actuary, it could reduce Social Security funding by $168.6 billion over 10 years, slightly accelerating the timeline. Now here is the biggest misconception. Social Security is not going away. It will not disappear completely. Even if the trust fund runs out, millions of workers will continue paying into the system through payroll taxes. Benefits would be reduced, not eliminated. For the average retiree receiving about $2,071 per month, that could mean a reduction of around $476 to $580. And now, the critical mistake. A 2025 survey found that 36% of people plan to claim benefits early because they fear the system will run out of money. This is a costly decision. Claiming at 62 reduces your benefit by about 30% permanently. Waiting until age 70 increases it to about 132% of your full benefit. That is a 76% difference. So claiming early out of fear often results in less money over your lifetime, even if future cuts occur. The only valid reasons to claim early are health concerns or immediate financial need. One more important detail. Benefits increased by 2.8% in 2026, adding about $56 monthly. But Medicare Part B premiums rose to $202.90, offsetting much of that increase. Most people saw only about a $38 net gain. Now, here are your 3 action steps. First, create your My Social Security account at ssa.gov My Account. This allows you to manage benefits, update direct deposit, and access important documents instantly. Second, do not claim early out of fear. Use official tools and consider your full situation before deciding. Third, review your Medicare plan every year during open enrollment. Costs and coverage can change. Finally, stay informed. Rules are changing quickly, and relying on outdated information can cost you. If this helped you, share it with someone who needs it. I am Edward. I will see you in the next video.